An easy example of some of the confusion that a patient can find is related to a very common but not normal condition of incontinence, bowel or bladder. It can be as minimal as a little bit of urinary leakage or as devastating as complete loss of control of the bowels. These conditions can come with a unique set of complications related to shame or embarrassment about the condition, sense of isolation. That person not only has a pelvic health concern, but they also have kind of a mental, emotional concern, and they may benefit from contributory advice from a mental health professional or behavioral health. Because of their symptoms of incontinence, a person may have begun to limit their fluid intake because they're worried about an accident, or they may have begun making some dietary changes that don't always make sense, and they would have benefited from a consult with dietary or nutrition. The limiting of fluids may have resulted in dehydration, and then that leads to a fall. The kidneys are affected because they're not getting enough fluid intake, and they may need consult with a nephrologist, that type of thing. Sometimes symptoms of incontinence will result in a person just thinking they need to strengthen the muscles of the pelvic floor, and so they start doing Kegels, and that's not always the answer. Too much overstrengthening in that area can lead to spasm and contraction of the muscles of the pelvic floor, and that person may have been better off seeking the advice of a physical therapist specialized in that area to find full function of those muscles, because it may be more related to a need to relax the muscles than to continue to strengthen. Because sometimes a person has been working too hard on strengthening, they will begin to get pain in the pelvis. Those muscles, again, are so contracted that this has resulted in painful conditions and difficulty with intercourse, pain with penetration, or pain with climax. Those kinds of conditions, even including erectile dysfunction, are often misunderstood, and a lot of people don't know that these are better managed, again, through physical therapy. Sometimes the input of a physiatrist is important. They can help a person with non-surgical interventions that will manage pain in the pelvis that can manifest because of originally incontinence, but that has resulted in muscular dysfunction. And the pain may be felt in the low back or the hip first, but be a result of the muscles of the pelvic floor. Once a person has kind of lived with the condition for some time, or if the condition has worsened, to a point where they just aren't finding solutions anywhere else, sometimes a consultation with colorectal surgery or urogynecology may be appropriate, because that condition requires surgical intervention, something like a bladder sling. Or some of our, we're on the cutting edge with CHI Health for research. Sometimes something like an adjustable implant is appropriate, and research is ongoing in this area. Very common conditions related to pelvic health can be inflammation at the prostate, even the miraculous changes that occur during pregnancy. Prostate inflammation can go on for many years, but sometimes results in a need for surgical intervention. And prostate surgery definitely impacts the muscles of the pelvic floor, similar to pregnancy, because these structures are interrupted and significantly burdened, and take some time to recover. CHI Health is a very large system with a number of providers and many disciplines that are ready to collaborate and meet the needs of every patient. As the Pelvic Health Navigator, I am by your side. I'm a human voice on the other end of the phone and ready to help guide you on your journey back to wellness.